So I've talked a bit about this before, and what I wanted to do today was just provide a little bit of an overview in terms of survivorship and cancer rehab here in Ontario. So as you may have heard the statistics, 1 in 2 Canadians are expected to be diagnosed with cancer at some point in their lifetime. And if you just flip to the next page, while that may sound like a really overwhelming number, and it really is, there is some good news in this, in that over the past several decades, we've made some really, I think, great advancements in terms of controlling cancer. And as a result, the mortality rates for cancer have dropped quite significantly. There's a couple of reasons for this. We've done a good job of tobacco control. We're able to detect cancer a lot earlier, and so it's a lot easier to treat when it's detected earlier. And obviously we have much better treatments now and more targeted treatments. So as a result, the 5-year sort of survival rate for across all of the different cancers is around 2/3 when measured from the date of diagnosis. But when you look at those people who survive their first year after their cancer diagnosis, that 5-year survival rate goes up to 81%. So it's really great. And if you look at some of the more common cancers like breast and prostate cancer, the 5-year survival rates are closer to 90%, which is amazing. So as a result of this, and the next slide just, we don't have to look at it, but it just gives you the Canadian Cancer Society statistics on survival across all the different sort of more common cancers. But if we move to the next one that just says survival but at a cost. What I'd like to just talk about here is a little bit about how our cancer system has been funded up till now and sort of set up. And it is certainly set up as an acute care system where we do a really good job, I think, of diagnosing cancer and treating it, but we're not set up as a system really to manage the growing number of cancer survivors and their needs. So really what you get is, if you look at sort of this infographic, is like a person just going along their lives, doing pretty well, have a job or taking care of their grandchildren or whatever it is that they're doing. They get diagnosed with cancer. They get put into the cancer system where they may receive, surgery, chemotherapy, targeted therapies, whatever combination of therapies. And at the end of that, they sort of get spit out at the end of it and asked to come back every 6 months for follow-up surveillance for their cancer. But actually no support in terms of helping them to manage the long-term late effects of their treatment and to help them get back to their jobs or back to their lives and improve their quality of life. So this quote here from Silver and Gilchrist from 2011, I think is a great quote from a paper. And Dr. Silver actually is a cancer rehabilitation specialist, but also a breast cancer survivor herself. So the experience of entering the medical system for many cancer patients is that they feel very good at the beginning, and then the treatments make them profoundly ill and often disabled. When they are sicker and more debilitated than they've ever been, they are discharged to follow-up care, which may include such things as routine screening for cancer recurrence, managing ongoing medications, and others, but this does not generally include a multidisciplinary rehabilitation intervention. In effect, the medical system creates a situation where high-functioning individuals are given life-prolonging treatments and then left to struggle with how to recover from the toxic adverse effects of these therapies. So in terms of the challenges, so we're here on this page now. In terms of the challenges facing cancer survivors, almost all of the treatments that we give to patients, whether it be radiotherapy, surgery, chemotherapies, immunotherapies, all can result in side effects. And when we talk about side effects, we can sort of think about them across the time trajectory. So during treatment, many patients will get what's called sort of acute side effects, which happens like while they're getting their treatment. So an example that I like to give is fatigue. Almost all patients get fatigue during treatment. The treatments make them fatigued. But what happens is for some patients, when treatment ends, you would expect that fatigue would then go away. But there's about a third to a quarter to a third of patients that for some reason, and it's not really clear why, that fatigue doesn't go away. And so for some people, they can report it up to a decade later that they still have this fatigue. So that would be considered then a persistent effect. So there's acute, but then if it persists after sort of 3 months, when you would expect it to have resolved, and it's persisting, then it's considered a persistent effect. And there's many persistent effects, including cancer pain would be another one. Also, new side effects can sort of emerge many years later out of the blue. So people can develop cardiac side effects, pulmonary side effects, things like that, that can just sort of happen out of the blue. And those are called late treatment effects. It's important for patients to be aware of what they're at risk for in terms of late treatment effects, but often they are not aware of that. These often go undetected and undertreated. Patients don't often report about it. They don't tell their doctors that they're suffering, and doctors often don't ask because there's not really much that they can do to offer to help them. About 40% of cancer survivors post-treatment report difficulties in basic activities of daily living. So that's just like bathing and dressing. And 55 to 60% report limitations in instrumental activities of daily living. So that's going to work, preparing meals, doing household chores, those types of things. There was a big study done across Canada through the Canadian Partnership Against Cancer. A couple years ago, I was on the steering committee for this, advisory committee for this, and basically they were looking at the experience of cancer survivors 1 to 3 years post-treatment. And they have a really great report on their website called Living with Cancer. And really what I think this highlighted for those of us who work in cancer rehabilitation, cancer survivorship, none of these findings were at all surprising, but what they reported is that 8 in 10 patients reported some type of physical challenge after their treatment had ended. 7 in 10 had emotional challenges, and 4 in 10 reported having practical challenges. So these are really high numbers. So the next page is really just, I think, hopefully what I presented to you is making really the case for the need for survivorship and rehabilitation programs for patients. Outpatient cancer rehabilitation is currently not funded in Ontario, actually anywhere in Canada, so you're not alone. But given the increasing number of cancer survivors, along with the growing evidence documenting the late effects, the fact that they're not able to get back to work, help their grandchildren, go out and do social things, I think this really serves as an urgent call for action for the investment of services to help people recover post-treatment and get back to their lives. I'll just finish by just talking a little bit about pain, although Dr. Flamer is going to be really talking about it in a lot more detail. So pain can be from a lot of different reasons why people may develop pain during treatment, and we know with cancer survivors it's one of the most prevalent and persistent problems. So in terms of prevalence rates, about a half of patients report pain during treatment. 66% of patients with advanced cancer have, not surprising, have cancer pain. But in cancer survivors, about 40% have this persistent pain that doesn't go away. And again, not surprising, pain can interfere with people's activities of daily living and impair their quality of life and their fulfillment in terms of their roles in society. Just like a lot of the other symptoms that patients suffer from post-treatment, pain after treatment often remains undiagnosed and undertreated. We don't really have services to send people to, and people don't often report it, and they're not asked about it. In terms of cancer rehabilitation, at Princess Margaret we do have a multi-dimensional, component cancer rehabilitation program that involves a number of different disciplines. We're very lucky to have this. We see, referred to our program, over 1,300 new patients a year. And then we see about 3,000 follow-up visits a year just at Princess Margaret. And we are only picking the patients that are doing the very worst, like the ones that are moderate to severe impairment and disability that can't get back to work. Those are the ones that we're seeing. And so it's really just the tip of the iceberg that we're seeing at Princess Margaret. And the only reason that we have this program at Princess Margaret is because of our foundation, who funds us to deliver this. But other patients will come to us from other hospitals and say, can we come and get your services here? And we're not able to accept them because they're not members of Princess Margaret. So unfortunately, that's just the state that we're in right now, and I hope that that changes soon. In terms of rehab and pain, I mean, pharmacological treatment, which Dr. Flamer is going to talk about, and surgical treatments are considered sort of the standard approach for treating pain related to cancer, but rehabilitation interventions can also be helpful, certainly providing patient education to patients, exercise therapies, manual therapies, general exercise therapies, and then also mind-body exercises can help people in sort of distracting them and managing some of the when they have persistent pain, like yoga and mindfulness and those types of things. So we can work together with anesthesiologists and pain specialists to provide that type of very multi-component comprehensive pain service to patients. So I'll hand it over to Dr. Flamer now.